spoke earlier to Linda Burney. She's the Shadow Minister for Family and Social Services and for Aboriginal Australians.
COVID-19 is an enormous threat to remote Aboriginal communities for a number of reasons. Firstly, of course, the compromised health system that many Aboriginal people have with one or two diseases. It could be, diabetes and heart disease or a number of combinations, but also the very big difficulty in self-isolation because housing is so crowded. Mercifully, so far, touch wood, there have been no outbreaks in any remote communities, but that doesn't mean the danger is still there.
No, and also when you consider how much chronic illness already exists within these communities.
Well, that's absolutely the point. The chronic illness starts at a very young age. We've got, heart disease in very young children. You've got respiratory problems. You've got often diseases that don't even exist in the broader population anymore. So these things are really important. And the other big concern has been something that you wouldn't think about in most places, and that is food security. If you are in a remote community, you don't have access to supermarkets and places like that. So the very small stores that often exist in a local community have to be well stocked, and they aren't always, and the prices are often extraordinary.
Look, the price gouging that we've seen has been a huge impact on a lot of remote communities. I can only imagine that remote Aboriginal communities have been even harder hit.
Well, I'm arguing very strongly for some sort of parity in terms of prices. I mean, who is going to go and pay $9 or $10 for a wilted cauliflower? Not many people.
No, and not happily, certainly.
No.
Transport costs as well have been an issue. We've not seen fuel prices in regional areas fall the way they have in metro areas.
No, there has been a lot of movement in metropolitan areas, and of course transport costs in rural and remote Australia are enormous. I know for Western Plains and further west of you, the fuel prices just increase, and of course diesel as well. So fuel prices, the higher they are, the higher transport costs, the higher food is.
Look, changing tack a little, but not disconnected, we've also seen a lot of concern around family violence during this lockdown period.
There is reports of increased levels of family violence, and when you think about it, I mean, family violence was a crisis before the pandemic, so you can imagine what that means, particularly in households where money is short, where people may have lost their employment, or they're worried about the mortgage, they're worried about paying rent, they're worried about whether they'll keep their job. We've seen an increase in alcohol sales, and that's been well recorded. And, of course, the level of frustration of being in lockdown, being in close proximity and not having any relief to each other. And we're also very worried, Nick, about women in particular and families in dangerous situations and not having the capacity to make that crucial phone call because the abusive partner is in close proximity. And we're really advocating very strongly for what's happened in other countries, and that is vacant motel rooms made available in consultation and partnership with organisations that deal in family violence. And even in France, there is a password that women can use when they go into a chemist.
A password to let people know that they are feeling that their life is unsafe?
Yes. I'm not quite sure what the name of the pharmacy girl, for want of a better term, in France has come on board with the government. There's a password that women can use when they go to the pharmacy, because that is one of the few places you can still go, of course, in lockdown. And if that woman uses the password, the chemist needs to know to contact the police to get help.
Given that we'd already seen some upsetting upticks when it comes to family violence right around this region, with a couple of areas in particularly notably high, have you seen much interest in this unused hotel room idea you've got?
I think the New South Wales government, certainly through some of the peak advocacy organisations in the family violence space, working closely with some hotels in Sydney, but I'm not aware of it anywhere else. But that doesn't mean that there are some state governments that haven't taken it up, but it is just a perfect opportunity. I noticed that in some places, I think it's in Victoria, they're using it for homelessness, but there is no reason why it also can't be used as safe places to increase the capacity for refuges and safe places for women and children to go. We are very pleased with the announcements by the Family Court that they will prioritise issues where there are children and violence and issues connected to the COVID-19 lockdown. That's very welcome, but it still does not help increase the capacity for frontline services.
So you'd like to see a more formalised and coordinated kind of approach to this?
I would, and I think it's something that state governments really should take on board. This is obviously a huge need, and there are lots of empty motel rooms, and I'm sure that there could be some very, very good partnerships formed.
Linda Burney, she is the Shadow Minister for Family and Social Services and for Aboriginal Australians, with some plans there to help people undergoing family violence at the moment.